Well, good morning, everyone. We're 2 minutes in. I know people are still filing in, but I'm going to start with our announcements of our upcoming grand rounds. Welcome. Thank you for being here for our HIV Center Thursday morning grand rounds. And I'll mention our upcoming rounds for the remainder of this year. And if anyone has any announcements before we get to today's event, please feel free to let us know that you'd like to announce some kind of event. So our next round on November 17th of this month will be one of our postdoctoral alumni rounds. And we have on that day, Pamela Valera, who will be talking about ending the HIV epidemic in correctional settings, a missed opportunity. And our second presenter will be Devaki Nambiar, who will be talking about institutionalizing social participation for health, lessons from India, Kenya, and Vietnam. And then the one other remaining one I will mention for this year is for our special December 1st World AIDS Day, which happens to fall on a Thursday. So World AIDS Day, December 1st, we have a panel. The title of our panel and the event will be "Does Silence Still Equals Death?" ? Activist perspectives on HIV, COVID, and monkeypox. We're going to highlight activism around these three diseases, monkeypox, COVID, and AIDS, against the backdrop of AIDS activism in the 1990s and 2000s. And we have a wonderful panel. I'll mention the names on the panel. They include Jeremiah Johnson from Prep for All, Kimberly Smith from Callan Lord, and Keleto Makofeng from Harvard FXB Center for Health and Human Rights. And this panel will be moderated by Raymond Smith, who is a long-term collaborator and former member of our HIV Center. So before I introduce today's speaker, is there anyone who has any announcements to make or any other events want to make us aware of? I don't see any hands being raised, or Stephen, I don't think anyone's said anything. So great. Let me move on to introducing today's speaker. We're very pleased to have one of our own locally from Colombia, who has been a long-term friend and collaborator of our HIV Center, Dr. Joanne Csete, who has degrees in education from Princeton, Cornell, and from Columbia right here in public health. Joanne is on the faculty in the Halburn Department of Public Health at the Mellman School. Her research and teaching have focused on the impact of criminalization and gender-based subordination on access to health services for people who use drugs, sex workers, people in prison, and others vulnerable to HIV, very important populations. At Human Rights Watch and the Canadian HIV/AIDS Legal Network, she documented and engaged in advocacy on human rights abuses against marginalized people facing severe health risks in more than 20 countries. She's worked on HIV/AIDS and other health and nutrition programs and policies in Africa for over 10 years, including in complex emergency situations in Rwanda, the Congo, and Burundi. She's the lead author, very importantly, of a report that came out in the Lancet Commission on Drug Policy and International Public Health in 2016. And she's here today to speak with us on a very important topic that we were commenting, it's been a while and we haven't heard about, so it's very important that we're hearing about today, the topic of criminalization of HIV non-disclosure. So as a reminder to everyone, be on mute during the presentation. We will have ample time for discussion and Q&A moderated by Stephen Sukumaran. And the floor is yours, Joanne. Thank you for being here and welcome.
Thank you very much, Bob. Let me just pull up slides. Whoops, wrong one. Share screen, slides. Okay, let me just get us to. Are you seeing slides okay?
Yes, and they're in presentation mode. They look great. Okay,
terrific. Thanks. Thank you so much for the invitation. Thank you for the kind introduction. About a year ago, I was contacted by a Lancet editor asking for a review of the situation that we're in with respect to criminalization of HIV non-disclosure, exposure, and transmission? I promptly said no, partly because I think review articles are a nightmare. That's one thing. But in addition, in the experience of the report that Bob mentioned, the Lancet Commission report on narcotic drug policy that I did a few years ago, it was a real fight with the Lancet to get references to non-peer-reviewed articles into the piece. And I knew that in this particular topic of HIV criminalization, there would be a lot of really interesting work from NGOs and other sources that we might have to fight about. I also thought that there are people much more astute than I am to do such work, and I was busy with other things. I gave them names of other people who I thought would do a good job. And interestingly, they came back to me again a couple of months later, not having found somebody, I guess. But in the meantime, I had talked to people who are actually more active in the advocacy and day-to-day advocacy in this area than I am. And they encouraged me to go ahead. And I did only because Richard Elliott and Edwin Bernard, I know these acknowledgements are usually done at the end, but I really can't go further without acknowledging them because they are true experts on the law in this area, especially the fine points that I don't always get. And I was so grateful that they joined me in this adventure. Again, in the way of disclosure, we didn't receive any funding for the work, which the Lancet invited, but I should note that we did wind up using a lot of reports from NGOs with which we were or are affiliated. Richard and I are both former executive directors of the HIV Legal Network, which used to be called the Canadian HIV/AIDS Legal Network. Edwin, as we'll see, is the executive director of the HIV Justice Network, which works almost exclusively on repealing and reforming laws in this area. So let me express my deep appreciation for their work. And the article in question came out a couple of weeks ago as an e-publication, so we only have the citation that you see here. So what are we talking about when we say, I'll use the shorthand HIV criminalization as we did in the article? What we mean is the application of criminal law with criminal punishments, that is to say imprisonment in many cases, to prosecute so-called knowing or intentional transmission of HIV exposure, and also failure to disclose one's HIV positive status. Intent in this case is something that's hard to demonstrate, as you might imagine, also doesn't exist in a lot of places, and some laws, in fact, don't even require it. I also want to note that while there are HIV-specific laws on the books in many countries, and I'll show you which ones those are in a second, there also are prosecutions of HIV transmission, non-disclosure, and exposure under other kinds of laws. This is the case, especially in Canada and some US jurisdictions, as well as many others, where these prosecutions are done under laws that cover sexual assault, homicide laws of various forms, reckless endangerment laws, and so on. This from the HIV Justice Network, which tries to keep track, shows a lot of information, actually. What we see, anything that's in blue or light blue here, are countries that have HIV-specific criminal laws, so that criminalize, again, exposure, non-disclosure, or transmission. And the ones in light blue are ones that don't have prosecutions that we know about, though I should say from the beginning that it is hard to know about prosecutions because they're not always published. And where we do have good information, it's mostly from civil society groups that have taken the trouble to, or academics that have taken the trouble to look through media reports and so on. We'll get back to that. So the darker blue are HIV-specific laws where there have been prosecutions. The purplish are places where there are prosecutions under non-specific, non-HIV-specific laws, and the few repeal cases that we have are noted in green. I should say about Africa that all that blue in Africa is partly the result of a USAID funded project from some years ago, where a consultation was held and a model law was come up with in a meeting in N'Djamena in Chad. And that N'Djamena model law was really pushed hard, again, by a USAID funded NGO called AWARE in many countries. And it's really terrible law in the area of HIV criminalization. It has some decent provisions when it comes to HIV related discrimination. Fortunately, as we see in West Africa, where parliaments just passed this law instantly, I think often fearing that they would lose USAID support if they didn't, there haven't been many prosecutions, but still the laws are on the books. This HIL virus term is not original to me. It was coined by my friend Justice Michael Kirby from Australia, who used it to highlight, especially in the early years of the epidemic in North America and Australia, that there was easy recourse to criminal laws for things like mandatory testing before marriage, mandatory testing before getting certain kinds of jobs, immigration restrictions of various kinds. These were all pretty stupid and awful laws that just contributed to stigma and discrimination. But also there are these laws, the HIV criminalization laws that we'll be talking about today. And they were given a big boost in the United States by the Ryan White Act, which had a provision tying the ability for a state to receive certain federal funding. To do that, they had to have laws on the books for prosecution of so-called knowing HIV transmission. So the laws sprung up like flowers. 34 states of the 50 have had HIV-specific laws, and there are others that have prosecuted under other criminal laws, including sexual assault laws. In addition, it's really worth noting that in most US jurisdictions and some places outside the US, when you're convicted under these laws, you not only have a felony record, but you might be also registered as a sex offender for a life or for a long period. So for all of us who've done advocacy in this area, we always have to answer the question, but there are people who probably do want to weaponize their HIV status and punish somebody by infecting them. So the UNAIDS actually came out with a good statement on this subject, saying, yes, there are those rare cases. There may be. They are really, really rare. And that's where criminal law is appropriate. But that's only where someone knows that she is HIV positive. Someone acts with demonstrable intent, demonstrability in this case being challenging from an evidentiary point of view. Demonstrable intent to transmit, that is, and in fact, transmission has taken place. Instead, what we really have is a whole lot of laws that don't account for what we know about the science of transmission risk. I'll say more about that later. We have laws on the books still that would prosecute people for spitting and biting. There's a famous US case from the state of the great bastion of human rights, the state of Texas, where someone got a 35-year sentence for spitting, an HIV positive homeless man for spitting at a policeman. Vertical transmission, that is to say mother to child transmission, where there's clearly no intent, is also prosecutable under a number of these laws. What we've found in the cases that we've been able to follow is that HIV seems to enhance sentencing. Punishments are greater than in other forms of negligent homicide or sexual assault where HIV is in the picture. So as many observers have said, this seems to be just punishing people for their HIV status. Sexual assault laws are applied here, where the intent to commit sexual assault is in many cases, if not all, highly questionable. And indeed, it's been very striking along the way, as far as we can follow these cases, that there are many, many convictions where there's been no transmission. And I'll show you some data on that from Canada later. We know that in today's world, calling on scientists to make a statement doesn't always do any good. But in this case, the International AIDS Society and others helped to mobilize a very, very impressive group of scientists. You see, if you can see the names here, and I know the slide is small. If you can see the names, you'll see the names of a number of presidents of the International AIDS Society and former presidents, other very eminent scientists who put together a statement directly addressing this problem of the unscientific nature of many of these laws. And I put the publication at the right that the HIV Justice Network put together, because often we have these scientific statements and we don't know how they're used. But the HIV Justice Network has actually followed, actually encouraged people living with HIV organizations to use the statement, and then has followed its use, how it's been used in parliamentary hearings, in other efforts to reform these laws. And what the expert consensus statement did was actually quantify the science on transmission with respect not only to man-to-woman vaginal condomless transmission, but also with respect to where PrEP is in the picture, where there's an undetectable viral load, where there's spitting, biting, and so on. And it's all in the article. You can look at it. I didn't give the details here, but they very helpfully said, you know, laws that are not accounting for this science really risk not only increasing stigma and discrimination, but actually encouraging terrible miscarriages of justice. And this all needs to be thought about more by judges and prosecutors. In addition, the experts were really helpful on what has been a very vexing part of this whole debate about HIV criminalization, which is the use of phylogenetics. You all in this audience will know more about this science than I do, but basically, as you know, phylogenetics enables scientists to determine, virologists to determine whether and to what degree strains of HIV are related genetically. Prosecutors saw this and thought it was very much like having DNA in other kinds of criminal prosecutions, in that they would be able to pin a given incidence of sex or other exposure to HIV to a particular person and make that case in that way. But as the expert consensus statement says, it's not the equivalent of human DNA. You can't convict somebody on phylogenetic evidence alone. You can exonerate them in some cases, and I think you can all imagine how that might work. So that was an enormously helpful thing to have, again, from such an august panel of experts. The matter of phylogenetics becomes more complicated when we look at the fact that molecular level surveillance is being used in a lot of places to follow clusters of HIV transmission or outbreaks, especially in what public health people call hard to reach populations. The problem here, as has been well pointed out in documents by the United States PL/HIV caucus and others, is that data is taken, anonymous data is taken from people with HIV, from their blood tests and so on, but it has happened that demographic and even identification info has been restored in some cases across jurisdictions, and all of this is done without consent of the people who originally gave the blood. In addition, as the caucus has noted, the federal government in the US has tied funding, certain kinds of funding for HIV, to the fact of having a system of molecular surveillance of HIV. So the PL/HIV caucus has demanded that, or has asked that this kind of thing be stopped until there's a proper protocol that will account for people's privacy rights, for informed consent, a proper protocol for data sharing. And internationally, there's great concern about this kind of thing in places where data privacy protection policies are not all that well developed. So the N'Djamena model law in Africa, and in many other cases, other laws have been sold to legislatures, to parliaments, on the grounds that these laws are needed to protect women from predatory men. That's often been the line. It was certainly a convincing line for all those laws in Africa. We have a very good statement from the International Community of Women Living with HIV, ICW, that basically says, look, this doesn't really work to protect women. First of all, because women are often prosecuted under these laws because they are the first in a couple to know their HIV status because of their contact with the health system due to their reproductive needs. In addition, the ICW statement makes a really nice case for the fact that these laws don't account for the situation where a woman may be forced by the law to disclose her status, but that may trigger violence or other retribution against her in the household or in society. Vertical transmission prosecutions continue. Those obviously involve women or pregnant persons. In addition, we reviewed research, especially from Canada, showing that, again, in many cases, depending on how these cases are covered in the media, Indigenous and immigrant women have been afraid to seek health services because of these laws. They have, in some cases, said that they were worried that they couldn't work as caregivers or child caregivers because of these laws. If it was known that they were HIV positive, they were worried that they themselves would not be able to get child care people to work for them. And in addition, we have really good evidence, thanks partly to the good work of the UCLA Law School, looking at details, again, media reports and so on in various US states, that in some states, the majority of prosecutions have been of women sex workers, and that's true beyond the US as well. I apologize for the wordy slides. I just wanted to be sure that all the information is there. So we were asked, especially by the Lancet editors, to look at the literature on health impact. And in fact, it's a literature that comes mostly from the US and Canada. And it's a literature that is quite ambiguous in its results. We do certainly have lots of good studies from Canada that show that health professionals themselves have been very much flummoxed by these laws, again, with media reports on high-profile cases, not really knowing how to counsel people about whether they should seek testing, which is really fundamentally of concern. There is some evidence from some places, but it's not terribly strong evidence that indicates that there's a chilling effect on seeking testing. But again, in populations that already face some level of intersectional criminalization or discrimination, that's where we see this effect particularly. And we'll look at the case of Illinois later. Again, I've mentioned already, it's the people learn about these cases largely from the media. It's not as though the court records are very public. And one has to say from studies that we've seen of media treatment of these stories that neither the media nor the criminal justice systems have been very well equipped to deal in a humane way with some of these stories. Racial bias is a big issue. Canada, we have good documentation. Very small percentage of the population identifies as Black in Canada, but relatively high percentage of the HIV transmission prosecutions have been in that population. Again, you see the results here from the state of Missouri. We would see that in many other places in the US. And again, the intersectionality of all this is something that we have to remember. We're talking about people in many cases who serve as defendants in these HIV criminalization prosecutions who are already facing behavioral criminalization in some ways, whether they're LGBT people or people who use drugs or sex workers. I just did want to show that with these figures from the HIV Legal Network, that the conviction rates on the right there are very high on these cases, much higher, and these are mostly sexual assault prosecutions. Remember, Canada doesn't have an HIV specific law. These are much higher conviction rates for all races than other sexual assault cases that you would find in the country. But also on the left to note there that there among the Black defendants, there have been very, very few acquittals. And again, we have these data from Canada only because of the HIV Legal Network having sifted through media reports and court reports that they could get access to. But I did want to show that a slim majority of cases where there was conviction, these are again on the left convicted cases, there was no transmission. So again, remember UNAIDS 3 conditions for when these laws are appropriate to use. And then on the right, we see here that the vast majority of these convictions, of course, resulted in a prison sentence. So again, part of our motivation in putting this all together was that, especially since 2012, when the HIV Justice Network was created, a true network of people, mostly PLHIV organizations, that are working in whatever jurisdiction they're in to look at these laws and to talk to parliamentarians about these laws and see what reforms are possible. We've seen some real successes. The Oslo Declaration that was put together on the edges of the AIDS conference that year brought organizations together. The HIV Justice Network has sustained that work under the great leadership of Edwin Bernard. And so the repeals since 2015, when everybody's got together on this in these countries that are listed here, have been really amazing. Some reforms in US states, a great reform in California where the laws were used especially against sex workers, and that's no longer the case under the statute as reformed. Well, you see the list. And a real slowing of cases in Canada, which has had probably the highest per capita number of prosecutions of any country. I'm going to unshare the slides for a second and show you a little video that comes from the state of Illinois, which is one that had that has had a really interesting experience of repeal. Let me see if I can get this. Tell me if you can't hear properly.
People with HIV can no longer be criminally prosecuted for exposing someone else to the virus without their knowledge. This makes Illinois the second state to repeal such a law, this one from the 1980s, making HIV exposure a felony. Advocates say the law discouraged testing and treatment for HIV and that this repeal is long overdue. Joining us now with more are Timothy Jackson, the Director of Government Relations with the AIDS Foundation Chicago, and the lead lobbyist of the bill's repeal, and State Representative Carol Amons, a Democrat who sponsored the bill. Thanks to you both for joining us. So Timothy, let's start with you, please. What was your reaction to the governor officially signing this bill last week?
Thank you so much for having us. Emotions were all over the place, to be completely honest with you. As a person living with HIV for nearly 12 years, there was anxiety, there was joy, there were a couple of tears, but mostly it was really a weight lifted off of my shoulders and the shoulders of people living with HIV across Illinois, that they won't have to worry about their health condition being weaponized against them. And so for that, I am eternally grateful to Representative Ammons and Senator Peters and Governor Pritzker and others for their work in advancing the legislation.
And Representative Ammons, why did you want to be a part of this legislation?
I think Timothy really expressed that, and thank you so much for having me on about this bill. This bill really reflects something that shouldn't have been on the books in the first place, but we needed to correct the wrong of the historical record when it came to people living with HIV. And so I wanted to be a part of that. I have a long legislative record of criminal justice reform. I found this to be not just criminal justice reform, but this is also healthcare justice in the face of COVID. And so I think it was high time that Illinois took the lead on this initiative. And I'm so happy that we got it signed last week and that the governor saw the importance of this legislation.
And Timothy, how did this particular law and laws like it, how do they impact people who are living with HIV?
Yeah, there are a number of different harms, of which one, it's not based on current science, because right now there's a thing called U equals U, which stands for undetectable equals untransmittable, which means a person living with HIV with an undetectable viral load, they pose zero risk in transmitting the virus. And so obviously that is a huge boon for people living with HIV. We understand that it's overly harsh and discriminatory to the same communities that are already ravaged by HIV, Black, Latinx, Indigenous, and LGBTQ communities. But more than all of those is it inflicts harm and also stands in the way of public health strategies, because a person couldn't have been charged with this law if they didn't know they had HIV. And so people literally told us well, I'm not going to get tested for HIV because I can be charged with this crime. And so obviously we understand that stands in complete contrast to what we want to happen. We want to encourage people to get tested and get into treatment. And so having something on the books that stood in the way of us doing that was obviously a huge barrier to ending the HIV epidemic here in Illinois.
And let's get into a little bit of that. An analysis of Cook County court data by the circuit shows that Black men make up more than 2/3 of the people charged under this law, and across gender lines, 75% of those charged are Black. And that's the circuit. That also comes from the Chicago Reader. Timothy, why have Black people been disproportionately impacted by this law?
Yeah, that's a great question. It's really just another example of systemic racism. I think Representative Ammons highlighted that not only is this a criminal justice issue, this is a healthcare justice issue as well. And it's something that we have really seen where you have disproportionate impact in a number of different areas. There is not just Chicago or Cook County centric. 1 out of every 2 gay Black men in this country will contract HIV in their lifetime based on the CDC. 50%. And just to kind of put it into, just really broader terms, you're looking at that statistic. I am a gay Black man living with HIV. And so that just really kind of puts into into kind of focus of the importance of making sure that we remove this law and that we really focus on education, prevention, and treatment, not only in the Black community, but Latinx community and others as well.
And Timothy,
I'm gonna stop it there. I want to be sure that we have time for questions. You can look at the link is there. You can look at the rest of the video if you like. Okay. I did want to say as well that, after so many years of advocating around what would be said in the global AIDS strategy that comes out of the UN General Assembly every 5 years now, we finally have some pretty good language, better than we have had, on this matter of dealing with all of the criminal laws that continue to impede rights-centered HIV responses around the world. And we have this new, you're all familiar with the 90-90-90-95-95 cascades. We now have a 10-10-10 cascade that comes from this quotation from the current global AIDS strategy, that we want to see fewer than 10% of countries that use criminal laws in these areas of same-sex sexual activity, minor drug offenses, though I think that one is too narrowly defined, sex work, and then HIV non-disclosure, exposure, and transmission are listed, which is great. And we see from the stats here that I've listed that we have a long way to go. We have a long way to go, let me just say. And UNAIDS has pointed out that all of the sort of knee-jerk police-based, security-based responses to COVID have just highlighted how much we need to get away from this recourse to criminal law in the face of infectious diseases that may emerge. Oops, there we go. We have some other initiatives that I just mentioned briefly. This relatively new global partnership on HIV-related stigma and discrimination, where countries pledge to have plans of action to report on them regularly. Something that I've been trying to work around the edges of for some of the work that I'm doing with the Global Fund. It also includes looking at harmful laws and policies. UNDP convened this Global Commission on HIV and the Law and has tried to support some countries to implement their very strong recommendations on decriminalization in this area. I'm really privileged to work with this Global Fund initiative called Breaking Down Barriers, which is one of the most important, financially anyway, important investments in human rights programs, peer paralegals, know your rights programs, legal services, as well as legislative advocacy. Richard Elliott and I are working right now under a Global Fund contract to look at investments that the Global Fund has made in the area of reforming punitive laws and learning lessons from how they can go forward. The new Global Fund strategy has a particular emphasis on investing in especially decriminalization of the in the laws related to so-called key populations. Anyway, we can talk more about that at the end if you like. The World Health Organization is in a process of validating certification of elimination of vertical transmission of HIV and other diseases. And they're requiring, as part of that certificate of validation, that the overly broad HIV criminalization statutes be reformed. That could be a good effort. We'll see how WHO sticks to that criterion. One of the challenges here with UN leadership in this area, I have to say, is that UNAIDS has 11 co-sponsor agencies, including UNODC, the Office on Drugs and Crime, which I've tangled with many times over the years. And they, and sometimes other organizations, are not so great on some of these. Well, UN Women on the matter of sex work has been challenging at times. So we see that I've been in a number of UN meetings recently on these decriminalization efforts to follow up to the political declaration from the General Assembly this last time. And it's really tough to get unanimity on some of these things in the UN system. We're so lucky to have this really great organization of groups from around the world that are working under the HIV justice umbrella to try to follow the cases, try to follow what's wrong with the laws, and try to bring these to the attention of parliamentarians. The HIV Justice Network keeps this database that you can find on their website. They periodically sort of summarize what's going on every few years through the Advancing HIV Justice reports, of which one came out earlier this year. It's very good. They have various training tools, as you see on the right there. They're funded by the Robert Carr Fund. A while back, they realized that they needed another entity to make this a true global campaign. And so this group called HIV Justice Worldwide was created. And they do a lot of strategizing about how to use UN contacts better, how to organize the various groups that are fighting these battles. In the US, I think probably some of you may be aware of the HIV is Not a Crime. They call it the National Training Academy. It's kind of a meeting of that has training and presentation of research. And I saw that a couple of days ago. They just announced their abstract opening for the meeting next year. The Zero Project is a leader in this. Some of you may know the famous case of Robert Suttle, who was a Black man who was convicted in Louisiana and served 6 months in prison for a case that should never have been before the courts. And he's now a driving force in the Zero Project. Maybe it doesn't make sense to say that, but every beginning law student gets some sense of what the purposes are meant to be of criminal law. Criminal law is a tool that societies should use against the most heinous offenses. When you restrict somebody's freedom, when you incarcerate, that should be for the worst, the most repugnant crimes. And so the purposes of criminal law are to incapacitate the offender. In this case, especially since there are no condoms in prisons around the world, it's really a problem. There's no real incapacitation if we're talking about stopping HIV transmission by incarceration. Rehabilitation, there's no evidence of rehabilitation in this case. There's really no evidence of deterrence except deterring people from seeking the health care that they should get. And obviously there's an element of retribution that is an intersectional kind of retribution that is driving all this. So just briefly in conclusion, again, we're looking at a whole lot of laws that don't reflect good science. We're looking at laws that exacerbate all kinds of discrimination and do not protect women as they promise to do. We're looking at people who have no demonstrable intent to cause harm, who are burdened by incarceration, criminal records, sex offender registry, and so on. We're looking at some degree of keeping people from seeking the care that they need, and some confusion among those who give health advice. The misuse of phylogenetic evidence, a bad precedent at a time of emerging infectious diseases. At the end of the article, we recounted the case of South Africa, where it was really the precedent of the HIV criminalization laws that led authorities to think that they could criminalize people who weren't abiding by COVID-related quarantines and so on. This is really not a good precedent to have on the books in so many places. It is a time of reform, and we expect to see many, many more repeals and reforms of these laws, thanks to the energies of and organization of people living with HIV. And we had a conversation with a couple of the Lancet reviewers, since so much of it's a real limitation of the piece that we put together, obviously, that the peer-reviewed research on the impact of these laws comes largely from North America. We recognize that right out. But should there be more peer-reviewed kind of research? We don't think so. We think that there should be support to organizations of people living with HIV in other parts of the world so that they can have the resources to monitor cases, which again is a time-consuming and difficult thing, so that they can have the resources also to work with the media, to work with judges, parliamentarians, prosecutors, and so on. And we hope that this article can contribute to that kind of goal. But in any case, overall, this is just a place where criminal law should never have been the tool to which policymakers turned. It is doing much more harm than good. I'll end it there. I know we want to have time for questions. Let me get the sharing off. And thank you again for your attention.
That was great, Joanne. Thanks for that very informative presentation. We'll jump into Q&A now. To our attendees, a reminder, if you have a question, you can enter the Q&A feature or chat, and I'll read it out on your behalf, or you can raise your hand and I will unmute you. Okay, I'll go ahead. You're on mute, Teo.
Thank you, Joanne, for this presentation. As Bob said at the introduction, this is a topic that we don't talk about that much. And at the same time, it's incredibly important to be aware of what's going on. So thanks for enlightening us in that respect, but also the efforts to change these laws. I was curious if you are aware of any research that is done among persons living with HIV in terms of their awareness of these laws, and also in terms of the impact it has on them. I was very happy that you included that little video, because it made me aware that one thing is you have these laws, but the other thing is it really impacts people who are living with HIV. And if you don't live with HIV, it's easy to just not be aware of that. So I was curious if you are aware of any research in that respect.
Yeah, we cited a number of articles, again, mostly from Canada, where obviously people can't react to these laws if they're not aware of them. So again, the media is very important. Also communications from the government. And again, I mentioned the ones that interviewed Indigenous women, for instance, in Canada, who have been particularly affected and also are particularly isolated from good information about a lot of things. There are a number of articles among gay men and other men who have sex with men in Canada who also said that, you know, these laws are crazy. They just make people more nervous about everything. There are a couple of articles that looked at how Black people with HIV in Canada get information and how they read the media, and also what AIDS service organizations are doing to inform people. So there is some literature out there. It's not huge, but I think what was said by the gentleman in the video is what one hears a lot, sort of anecdotally, through AIDS service organizations. That was certainly the case when I was working in Canada, and we worked closely with ASOs. They were really worried about how people learned about these cases. And in the Canadian media, they're often, because so many people who are prosecuted are either immigrants or racial minorities, the stories often have this tone of, well, you know, these people are not reflective of Canadian values, and that's the sort of thing that really scares people who already feel like they face discrimination because of their status, or they might do. So it's again not a huge literature. There's probably more work to be done there, but it's a good question. there's 85 or 90 references in this crazy article, and everyone that tried to in any way survey, a lot of them are qualitative studies, though some of them that tried to survey populations of people living with HIV are cited.
Thanks, Teo. Bob, you can go ahead.
Yeah, thank you, Stephen, and thank you, Joanne. This was really just it was a great, well, it was just great. It was a great overview, a great history, but also bringing it current. Could you elaborate on? I mean, where I've been in, I've seen discussions and debates that I think have been challenging are around the identifying of clusters, you know, and using the phylogenetics. I mean, part of the plan for America of ending the HIV epidemic, right, includes responding quickly to HIV outbreaks to get needed prevention treatment services to people who need them. And so could you just talk more how that's dovetailed with everything you talked about, and where, I mean, I know that I've heard people talk about the protections in place if we're identifying clusters, anonymous, and you made reference to this in your presentation. But where are we at with that debate? And how are health departments using these clusters or outbreaks in a way that is respectful of privacy?
Yes, since most of my work and research is now outside the United States, I'm not the best place to answer that question, but the US PL/HIV caucus, which has done such a good job of following this, says that they have some cases where data have been shared across states with some demographic information de-anonymized, if you will, and that police departments have also been very interested in these data because they include data on sex work and drug use. I don't know the details of those. And I think, again, the effort of the caucus to put this on the agenda and have a serious consultation with NIH, CDC, and HHS and so on to get some guidelines on the books is an active one. And yeah, I don't know where we are in that. I mean, I think there are so many parts of the ending HIV that the people living with HIV organizations have been active in. This one is a little bit arcane, but it's certainly on the agenda. And you know, the people who are on the Presidential Commission on HIV from the caucus have continued to try to push this, as far as I know. The push getting some clear guidance and some clear protections of privacy. I know that I have a particular concern about this, having worked so much in Africa, because it's very clear that data, not necessarily phylogenetic or molecular surveillance data, but other kinds of data that health authorities have put together, have been of great interest to the police and have been used by the police to plan their crackdowns on sex work and on drug use. And so we really need, it would really be good to have a great example from the US on this matter, so that that could be shared. And the UN should be a little bit more active on this too.
Thank you. Yeah, it's a complex issue, and you know, I mean, it's right. I mean, there is the voice that says, well, if it's a tool that could help get services to communities or clusters that need it, you know, how do we, you know, it's complicated. Yeah,
absolutely. And I think that's why it's significant that the PL/HIV caucus in the US, for instance, has not called for an end to this, has called for rather guidance so that there are some guardrails around it.
good. Yeah, well put. Thank you. I agree.
Thanks, Bob, for your question. Are there any other questions from our attendees?
Yes, Joe.
Joanne, when you showed the paper that was written, the position paper that was written by the former chairman of the International AIDS Society, you made a comment about, and this is not what you said, but something like, well, the relevance of these kinds of papers is usually not so great. But then you said, well, in this case it was. You have looked at changes in laws, and I was wondering whether you have an idea based on what you have looked at. What are the most critical factors in getting a law to change? Is there a magical recipe for that, or is it more a matter of, well, it really depends on the local circumstances and so on?
I don't think there's a fixed formula, but as in all of this kind of advocacy, the human stories, of course, are helpful. Robert Suttle has been a particularly good ambassador for this fellow who spent 6 months in jail in Louisiana, because he talked about the circumstances under which he had sex, and he knew that he wasn't transmittable. So I think where we've been able to tell the human stories, there's a great organization, regional organization in Eastern Europe and Central Asia of women living with HIV, and they've done a great job of collecting the stories of women who have been prosecuted, and they've made some good inroads, at least to open debates in parliaments, just by telling these stories. And these women had no intent to transmit. They were in relationships where they weren't the only one with HIV, but they were the ones diagnosed, etc. So I think that's an important thing. But I think also with any kind of changing of criminal law, which is inevitably a long process, you need organizations and people who will be able to stick with it, who will be able to stay with it for years, who will be able to gather their parliamentary allies, who will be able to continue to record harms, continue to record cases, continue to record unjust convictions, and so on. And that's been the beauty of the HIV Justice Network. I can't say how impressed I am by the way that Edwin Bernard and his colleagues have managed to really, again, organizations that are networks, often they just ignore their members. They've really, they've shared funding, they've shared technical support, they've shared training, they've brought people together for all kinds of sharing of experiences to see what it is that has worked. And even, again, recognizing, I think it's been really important that they recognize that repeal is not going to be possible as a first step in a lot of places. So you maybe start with reform. So again, the California law that now will not have 85% of the prosecutions be of sex workers. The Russian and the Belarusian laws, those are two, the Russian Federation and Belarus have huge numbers of prosecutions telling the stories of how, these laws that were allegedly meant to protect women are now being used to harm women, and so on. Again, it doesn't work in every place, but I think a step-by-step learning from other experiences has been really effective in their case. Right.
Thanks, Joanne. We have a question from May Tan. Apologies if I mispronounced that.
That was good pronunciation. Thank you. Can you hear me?
Yes.
Thanks. Joanne, I wanted to ask, I'm a new postdoctoral fellow here at the HIV Center, and I wanted to ask a question about the country where I usually work, Zambia, which on your map showed as cases on the books, but they don't have HIV specific laws. And I only know there that homosexuality is illegal. I was wondering if you could explain that condition in terms of cases on the books, and how people know about that, and what the way forward is in countries like that.
Yes, a very good question. So Zambia is one of the countries that decided not to adopt the famous N'Djamena model law on HIV, to their credit, really, but they have some prosecutions, not a huge number, I think, have been brought forward under, it might be sort of reckless endangerment type laws. I'm not sure the homicide laws have been brought in. And again, we don't have open court records, so the only way that those cases are known is through media reports. And I think there have been a few prosecutions of women in Zambia. What is the way forward to tell these stories, I think? And again, I think it's really useful. The other thing that has been well used in addition to that expert consensus statement is this Oslo Declaration, which if you're at all interested in this topic, I really encourage you to read it, because it basically says, look, in a place like Zambia, HIV will be driven by people who are undiagnosed more than by people who know their status and have some kind of crazy intent to transmit, which is just not going to be there. So what we really need are better services for everyone, better information about where services are, better information about the benefit of services and testing and so on. And the resources that are sorry, the resources that are wasted in any kind of criminal prosecution, whether through an HIV specific law or otherwise, are huge. It's expensive to bring a case to court. It's expensive to bring a prosecution, even if there's a settlement without a trial. So I think that there have been efforts in Zambia among the people living with HIV organizations when these cases have come up, but I think there haven't been many recent ones to say, look, you know, this is waste of time. These cases give us a false sense of security because we're not really preventing anything by these cases, and we're wasting a lot of resources. Again, cases in Southern Africa in general have slowed somewhat, I think, with a better understanding of the U equals U science.
Thanks very much.
Thanks, May, for your question. Any other questions for Joanne? All right, if not, Bob, I'll turn it back to you.
Okay, thank you. Thank you, Stephen. Thank you, Joanne. Thank you, everyone who is attending today. This was really good. I got a lot out of this. So I want to just remind people of, again, what I announced earlier. We'll see you next on November 17th, hopefully, for our postdoctoral alumni rounds. And then please hold in your calendars December 1st, World AIDS Day, for our special panel on that morning of our usual time for grand rounds. Thank you, everyone, for being here. Have a good day, rest of the day, and a good couple weeks. See you in a couple weeks.
Thank you very much.
Yeah, thank you so much, Joanne. Take care.